Hi, I'm Matt Schwartz, Chair of the Mayor's Healthy Hometown Worksite Wellness Committee. I'm here with Maggie Mangino, who's with Norton Healthcare, and Rebecca who's with the YMCA. And we just finished up a program this morning, the worksite wellness conversation focused on diabetes. So I'm going to start ask a couple questions of Maggie. We talked a little bit this morning about the Asheville project that a lot of people have heard of, and one other, I don't recall the name, but you all use that at Norton as kind of your benchmark or example. So what are the couple things that you pulled from that? I mean, what did you do at Norton Healthcare based on what they had done related to diabetes?
So we took both the clinical and economic outcomes from the Asheville Project and the Diabetes 10-City Challenge and implemented a disease management and medication therapy management program for our employees. Where basically the employees meet with a trained pharmacist to review their diabetes management. They talk about education, diet, exercise, monitoring their blood sugar. They get reduced co-payments on their diabetes medications and testing supplies. And then that pharmacist works with their physician to help optimize their treatment. So far with our preliminary results, we've seen both good clinical benefits with reducing A1Cs and also some economic benefits as far as reducing hospital admissions and ER visits.
So actually, I'll retro back a bit because I'm recalling that there was the reasons that you did this. What I recall, diabetes #3 health cost in the system. So what were some of those? I mean, why is diabetes something to focus on?
Yeah, so
in terms of the numbers.
Right. So one of the reasons we wanted to focus on it is because you can make a difference. And even with making a small difference, it's 1% A1C drop in your A1C, you can make both financial and economic impacts. So that was kind of a big thing, that diabetes is a huge cost as far as a chronic disease state for our employer. And then also just in general across the country, we spend a lot of money on diabetes. So if we can make an impact on that, and that in turn helps both our employees and our employer.
And I know we talked also about just the fact that the percentage, I mean, it's 1 in 10 people have diabetes today. In 15, 16 years, I think, Becca, you pointed out, we're going to get up to 1 in 5. So significant. So what you also talked about, we had one comment that was talking about the challenges. You do sometimes run into challenges in terms of getting people engaged. So what have you all done to succeed? What have been the keys?
So some of the big things is just partnering with our community resources and using the programs that our wellness program already had in place. Like we've got great smoking cessation programs set up and referrals into the Cooper Clayton community smoking cessation classes. We also have partnerships with the YMCA with other gyms for gym discounts. So we've kind of used a lot of those community resources to help the success of the program.
So, a good segue, because one of those community resources we talked about was the Y. And so the Y put together they have a specific diabetes program. So why don't you, Becca, give us a quickie summary of that program.
So we have our YMCA's Diabetes Prevention Program, which is a program specifically for people who are not diabetic yet, but may be at risk for developing type 2 diabetes. So it's a prevention program. And we work on reducing their risk of developing type 2 diabetes through just a little bit of weight loss and increasing their physical activity through a year-long program. And we separate that up into 2 pieces. There's initial 16 weeks, where they meet once a week for 16 weeks, and we go over different topics each week in a group discussion setting. So things like basic nutrition, the importance of physical activity, problem solving, stress management. And then after those initial 16 weeks, they come back once a month for 8 months, and those are our maintenance sessions. So an opportunity for them to check back in, make sure they're still implementing some of those healthy lifestyle changes.
And then I guess you also talked about the different ways that people can engage. So Norton's, of course, has brought things on site, but you also have opportunities for people to come to you.
Yes, so we host, the program is very mobile. We can bring it on site to an employer, or we have it on site at our YMCA. So we have about 5 different YMCAs right now that have the program on site. So we're looking for either an employer to bring it to their employees, just have it right there at work, or to refer their employees who are at risk into our program at the YMCA.
Well, thank you both. It was educational. And I just got a comment from one of the participants who said, you know, I just don't feel like I'm wasting my time when I come to these every month. So that's a great commentary. I also want to take a second. We had a couple of other resource directions. So behind me here, and I guess if you're watching, you could just press pause on your computer and you can look at these. But a couple of websites that give you access to resources and information. Some of them are info, some of them are peer-driven, And anyway, so these were some of the things focused specifically on diabetes. And so we do these programs the third Thursday of every month, typically at Baptist East Milestone, and we welcome you to come out and look forward to seeing you next time.